Imagine ordering a package online. You type in your city, street, and zip code, but completely forget to add your apartment number. The delivery system knows the general neighborhood, but it lacks the final detail needed to find the right door. Without that precise destination, the package bounces right back to where it started, return to sender. In healthcare, we use a system called ICD-10-CM. Every time a patient visits a doctor, their diagnosis is translated into a specific string of letters and numbers. These diagnosis codes function like a mailing address. To get the medical information where it needs to go, you have to build that address piece by piece. If a medical coder misses even one required character at the end of that sequence, the medical claim becomes invalid. It gets rejected and the facility goes unpaid. An ICD-10-CM code provides a specific structure for this data, with enough room for up to 7 characters. The first 3 characters are the category. This foundation works like a city and state, identifying a broad condition. For example, category M54 identifies general back pain. If a condition has no subdivisions, this 3-character category stands alone as a complete code. Most conditions require more detail, characters 4 and 5. This subcategory acts like the street name on our map. These additional characters provide clinical details that narrow the focus of the diagnosis. In our example, adding the subcategory characters transforms the broad M54 into a specific diagnosis, low back pain. Every character added moves the diagnosis further along the path, refining a broad region into a specific clinical location. Characters 6 and 7 provide the highest level of detail. In our address metaphor, this is the exact apartment number. Regardless of the length, whether 3, 5, or 7 characters, the most specific level of subdivision is always called the code. Certain complex scenarios, such as injuries or obstetric cases, mandate the use of all 7 slots. If the rules require a 7th character and it is missing, the code is instantly invalid. The system rejects the claim immediately. Coders use the tabular list to find these requirements. This manual uses an indented format to show relationships. This layout works like a staircase. You start with the category on the left, tracking indentations to the right to reach highest specificity. Following these visual indentations acts as a safeguard, ensuring you don't stop at a broad category when a more accurate code exists deeper. To keep this architecture in mind during a busy workday, we use a memory tool called the MJ-GEM. The rhyme follows the layers of the code. 3, 4, 5, 6, 7. Build the code to heaven. This rhyme captures the logic of the entire system. Accurate coding relies on delivering a precise, complete package of data to ensure the message arrives exactly where it needs to go. Whenever the manual indicates a 7th character is required, that character must be applied to create a valid code. By following the roadmap of indentations and building a complete digital address, you ensure clinical accuracy and code with professional confidence.